On January 25th, 10 days late, the Shumlin Administration released a report by the University of Massachusetts Medical School and Wakely Consulting that was supposed to, according to the law, Act 48, detail the amounts necessary and necessary mechanisms to finance Green Mountain Care, Vermont's single-payer healthcare system. The report fails to do so, and a group of legislators and citizens gathered in the State House to call attention to the administration's failure and to demand that they do comply with the law. Senator Joe Benning pointed out how the lack of information about details of Green Mountain Care is having a negative impact on families, businesses, and our economy.
Good morning. My appearance here is merely to remind the administration that we are all of us, subject to rules and regulations with respect to health care that we are going to have to abide by pursuant to the law. There are many businesses in this state that are hanging on edge waiting to find out what their requirements are going to be, and they need to have the information necessary to make important decisions for themselves and their employees. At this point in time, all of us, including those of us in the legislature, need to have a clear understanding of what the game plan is. At present, we don't have that game plan.
Representative Cynthia Browning, an economist by training, shed some light on the shenanigans being played here.
I'm aware of something called entitlement bias. This is a tendency by elected representatives, by politicians, to want to be very generous in providing benefits. But then they're not always as thorough about providing the financing for those benefits.
And the financing for Green Mountain Care is significant. According to even the rosy scenario portrayed in the UMass report, $1.6 billion in new taxes will be necessary for single payer. That's a greater amount of taxes than is now collected in Vermont from the state income tax, sales tax, rooms and meals tax, and gas tax combined. Jeff Wenberg of Vermonters for Healthcare Freedom explains.
The report that was released late last week was supposed to answer the critical questions about how Vermont will fund Green Mountain Care and how the $1.6 billion in new taxes will affect the state budget, our overall economy, our businesses, and our families. Instead, we got estimates of costs and savings with scant documentation, misplaced tables, dubious claims of new federal revenues, and absolutely nothing regarding the taxes needed to be imposed to support this program. There is no analysis of the impacts on anyone. To put it bluntly, this report does not comply with the requirements of Act 48. The biggest thing that is missing, and the critical one, is the financing plan, specifically how we're going to raise the $1.6 billion that are estimated required for new taxes. Absent that, it is impossible to comply with another critical requirement of the law, and that is what is called a macroeconomic study. In other words, what impact will this tax change and the reduced premiums that are part of this, what is the net impact on our state government, on gross state product growth, on employment by sector, on the cost of certain services? What is the impact on our families, on our incomes, on our businesses?
The Shumlin Administration wants to drag its feet on providing these critical details for 2 more years, but these legislators and a growing number of citizens are demanding to know more now. And the law appears to be on their side, if only the administration will follow.
Financing is the hardest part. The governor and the administration are not above the law. They need to provide us with all of the information that was in Act 48. Thank you.
What we've done to try to address this is we've prepared a letter. Our caucus has prepared a letter that we'll submit to Secretary of Administration Spalding today. I provided copies to all of you, and if you need a copy, I'd be happy to do that. That requests or urges the administration to comply with the law within the next 15 days. In concluding, I want to say this is not a debate about the law. This is simply complying with the law that was passed by this body in the last biennium. You have to comply with the law. I have to comply with the law. The governor and the administration should have to comply with the law.
All of this raises a serious issue of trust. If the administration is neither willing nor able to provide information that they are required to provide under Act 48, why should anyone believe they will be willing or able to provide the health care that they will be required to provide under Act 48? The latter is significantly more complicated than the former. This episode does not inspire confidence.